Can you hear me? Other than being very short. Let me switch. 1 second. Get the slides up here. All right. Good evening. Thank you all for coming. My name is Maria Thacker-Gothi. I am Executive Director for the Georgia Global Health Alliance. This is one of our first events we've ever done publicly, and we're really excited to be here. I'd like to thank the Task Force for Global Health for hosting us in their wonderful space. Thank you to Paul, Dave Ross, and many others here for always being supportive as this alliance gets off the ground. So the Georgia Global Health Alliance was founded a little over 2 years ago by Dr. Lou Sullivan, Dr. Mark Rosenberg, and a number of our large organizations here in Atlanta, including the Carter Center, the Task Force for Global Health, the CDC Foundation, and a number of other supporters in the global health community. We're really here to be a connector, to help mobilize, advocate, and educate the general public and our policymakers around global health issues and challenges, and educate them as to all the great work you do, and also help grow this community from an economic development standpoint. We have a number of exciting initiatives we're looking forward to rolling out in 2019 in partnership with the Metro Atlanta Chamber and Deloitte. You can sign up for our e-list at globalhealthatl.com, and next quarter we'll be excited to really start featuring a lot of exciting things that our community has been doing behind the scenes in partnership with the corporate, private sector, a number of NGOs, the government, and a number of other partners in economic development to grow Atlanta's global health community here and the state's community here, and really raise the profile of the sector on a global scale in many respects. So I don't want to spend a lot of time with this on Global Health Alliance. Our information's online. I want to kick off our panel. It's an exciting time for global health, a little bit of a challenging time too, I think, from a political standpoint. So the Alliance is really excited to welcome a number of our partners from DC and a number of other states throughout the country who we've been engaging with for the last 2 years. I will be, these are our partners, the Global Health Technology Coalition, the Global Health Council, PATH, who many of y'all are familiar with, and the U.S. Global Leadership Coalition. This is all being coordinated and pulled together, which I'm very grateful for, from the Kyle House Group. Porter Delaney will be joining us in a moment to really kick off Kyle House Group, their mission, and what they're going to bring to our region and our state here in Georgia. And I'm excited to hear how this conversation goes. Please know that we will have a fair bit of Q&A session at the end of this panel, so please be sure to let us know if you have any questions. We had an exciting week last week, and here in Georgia and a couple other states, we have some ongoing counts occurring. So we will see where all that plays out. But we hope the Georgia Global Health Alliance will soon be that voice on behalf of the global health sector to really coordinate and educate our policymakers and our general community about the great work that you do. So, like I said, we have a number of great panelists, and they will be introducing themselves in a few moments. But I'd like to welcome to the stage Porter Delaney. He's founding partner with the Kyle House Group. He came to us through our partnership with the Washington Global Health Alliance, which is our counterpart in Seattle. They help get us off the ground as an organization, and they additionally have a policy arm, and they work closely with Kyle House Group, who has a focused mandate as a lobbying group in DC that is really well funded by the Gates Foundation, and I will let Porter dive into that. But it's an exciting partnership, and there's not a group like Kyle House in DC aside from them. So with that, I'd like to welcome Porter to the stage, and he will kick off today's session. Go ahead and hit next for your slide.
Great. Thanks, Maria. Good to be with all of you. Good evening. I'm going to just, basically my job is to set the context, and then we're going to have your panelists come up here and we'll have a discussion about current politics, trends in global health after the election last week, sort of where we're headed.
Sorry.
Oh, you're fine. And at the outset, I did just want to give a little bit more of an introduction to our organization and myself. So the Kyle House Group, as Maria said, we're based in DC. We're a traditional government relations firm. We're kind of in an untraditional space, working on global development, global health. And our partners, or our clients, if you will, in the nonprofit sector are really 3 segments. So we work with foundations, like Maria said, the Bill and Melinda Gates Foundation, Hewlett Foundation, Rockefeller, United Nations Foundation. We work with NGOs I'll give a little bit of background myself, but I essentially got started working for Bono, the Irish rock star. Worked for him throughout the Bush administration, helping to lead their government relations and lobbying work when he first got going in advocacy around debt relief and then global health in particular and global development. And then lastly, we in addition to NGOs like CARE and PATH, actually, Brendan here, PATH would be one of our clients, a number of NGOs. We advise international organizations. So we help UN agencies like UNAIDS or the Food and Agricultural Organization or other international multilateral organizations like Gavi, the Global Alliance on Vaccines and Immunization, with their work before the U.S. government. So whether that's pursuing funding, our policy initiatives, or building partnerships. And then lastly, we listed here some of the government agencies here in the U.S. government, also listed the Department for International Development. So we work with a lot of the large bilateral donors, international organizations, and then throughout the U.S. government. What drew us here, as Maria mentioned, so we've done work over the years. A lot of our advocacy is outside of Washington. So we look to partner with universities, we look to partner with World Affairs Councils, and certainly any sort of coalition-based organization in a state. In this case, with Global Health, we got linked up, as Maria said, the Washington Global Health Alliance, also the Triangle Global Health Consortium and the Research Triangle of North Carolina. I got pulled in through a process with the Robert Wood Johnson Foundation where they were providing some funding to help these regional organizations, also the one in Boston, to take a look at sort of best practices and how could they become stronger platforms for collaboration as well as for advocacy. And in addition to the regional health alliances, some of the other constituencies that we would work with would be universities. So we've partnered a great deal. I think there's probably about 60 or 70 universities now that we've collaborated with over the last 10 plus years, hosting events with members of Congress, bringing them to Washington, getting their students engaged, their faculty, their researchers, just as the universities are here in Georgia. The ones that we partner with across the country are major recipients of funding from the U.S. government. And if we can get the members of Congress in those states to view these issues through their universities and their work, that always seems to be a great path towards getting members more motivated to lead on development and health. So these are just a few of the universities that we work with. And then other types of organizations. I mentioned World Affairs Councils, Rotary Clubs, who we work with a lot all over the country. And then other constituencies. You mentioned the American Farm Bureau Federation here on issues like global nutrition or food security. We would work with them and their state farm bureaus. In terms of turning to the topic now of U.S. global health leadership, I just want to get some basic context. Most of you would know this, but for those who don't track the U.S. government role, just a couple of sort of facts and baseline points to then tee up our panelists to get more into the post-election politics and the environment we're operating in now. So when I got started around 2000, I was lucky, I guess, to get involved in global health policy and advocacy right at the beginning of what was a really historic period in terms of U.S. growth of investment in global health. So as you see here from 2002 to 2010, this was the peak period where every year we were getting advocates and leaders in Congress and the administration $1 billion increase per year because of the president's emergency plan for AIDS relief, which we went from a few $100 million a year in HIV/AIDS to $6 billion in a short space of time. Malaria, vaccines, President's Malaria Initiative's PMI was referenced there. And that essentially has been the funding that we've been defending since the financial crisis. So since 2009, it's really gone from a strategy of trying to grow funding in global health to protect funding in global health and to figure out the right sort of complexion of that funding. And as we've taken on new challenges, we'll talk tonight around global health security or neglected tropical diseases. It's challenging to figure out ways to prioritize within a constrained budget. But that's essentially the environment we're in now. And it's worth noting, this next slide will just kind of get into the last point here. This $10 billion a year, it says $8.3 billion here. It depends on if you're talking about sort of just, there's the Global Health Program account, which is state and USAID. And then when you include HHS and CDC and NIH, you get to about $10 billion a year. Even if you're at $10 billion a year, we have a $4 trillion a year federal budget. So that is 1/4 of the federal budget. So you can see there's a very small slice. Now, we did make sure that we're getting everything out of that. But when we talk about budget cuts later on, we're not going to be balancing any budgets by cutting global health. It would be insignificant with regard to the size of the U.S. Budget. And something that we might talk about, a colleague from USGLC here in a little while, one stat that hasn't changed in the 20 years that I've been working on this is the public perceptions on how much money we spend, the American people thinking we spend the U.S. government on foreign assistance. So if you go out and ask a broad sort of canvas of Americans, what do you think we spend? They kind of offer different options. The mean is 28% is what they think. So 28% of the federal budget on foreign assistance, whereas overall foreign assistance, which is about $35 billion a year, is less than 1% of the federal budget. If you ask Americans how much should we spend, they say 10%, so 10% more than we're spending today, which is just an interesting sort of perception issue that we deal with as we do advocacy and global health. This little maze here just gives you a sense of who are the leaders within the U.S. government on global health. So primarily we're talking about state, USAID, and HHS. I won't go into any detail here, but when you're talking about funding, it's through these agencies and these sort of sub-agencies and offices that the majority of U.S. government global health funding. You would see actually the State Department would be the biggest piece because the PEPFAR HIV/AIDS program sits under state, and that's about $6 billion a year. USAID would be the biggest implementer. HHS would be the biggest on the research side, the work of CDC, more sort of the clinical capacity side of things. And this is just another quick slide noting this is how the U.S. government sort of advertises a division of labor across disease-specific and then population and sort of related programs. This would encompass about 99% of the funding in the programs within the U.S. government on global health. And then just to make the point of how significant U.S. leadership is, so the U.S. Commitment of about $10 billion a year, that's out of a global commitment of $35 billion a year. But in certain sectors, I mean, we're the huge player. So in HIV/AIDS and malaria, you know, you're seeing how it can be 50, 60%. And as the U.S. made significant ramped up commitments in these accounts and in these program areas from 2000 to 2010, our partners followed us. And so you saw similar trends of funding going up, whether it was through multilateral mechanisms like the Global Fund, Gavi on vaccines, or others, or through bilateral commitments by our partner governments. We're going to come back later. There's a lot on this slide. The main point is what you see all the way to the right. We're going to talk about where are we in terms of the politics around the budgeting of global health. And since the Trump administration came into office, sadly, global health has not been spared in terms of the proposed cuts to foreign assistance, which have been about 30 to 35% per year. So global health cuts have been proposed on the order of basically 25%. It varies across account here, as you can see, but on the whole, about 25%. So in the first budget request, you'd see an account, so in FY18, then the FY19 was submitted. We'll see FY20 in February of next year. But in the first budget request, you had programs like family planning, for instance, which were zeroed out. As we'll come back to later, and as you know, the president can submit a budget, but it is Congress who decides the funding levels. So the good news is the last 2 years, FY18, which is done, and FY19, which is going to be coming to a close. You'll be reading about in the paper. This is something that Congress has to deal with now before the new Congress comes into effect. Those numbers in 19 from Congress also hold the line of maintaining full funding for global health programs. But that could get increasingly challenging, as we'll talk about with the panel. And then just a few successes to know. I mean, global health is really unique as an advocate because you can measure very clearly and you can communicate very clearly what outputs you're achieving through the inputs. So things like over the last 25 years, reducing under 5 child deaths by 60%, maternal deaths by 50%. These are huge numbers. You can see at the bottom what that translates into in terms of going from 12.6 million, I think it says, to 5.4. I can't read perfectly here, but that big decrease that you saw in terms of, and that was investments in malaria and investments in preventing mother-to-child transmission of HIV/AIDS and getting vaccines out there. So all these big programs are what led to those successes, and it truly was U.S.-led, but a multilateral effort. A few of the other successes, PEPFAR, I really cut my teeth in this work, working with Bono and others back in 2003 when this initiative was launched in the State of the Union address by President Bush. At that time, 50,000 Africans had access to treatment or were on treatment for HIV/AIDS, the ARV treatments. Now you have 11.5 million, 14 million globally. That's a huge success story. Of course, it's not just those lives saved, it's their families, it's their communities. That had a huge impact, not just in health, but economics, stability, et cetera. And then looking at vaccines, I won't go through all the stats there, but the short of it is, I mean, this is one of the reasons the Gates Foundation was so invested in vaccines is from a dollar return on investment. It was hard to find a better one in terms of if you're able to immunize children, and if you're able to develop more advanced vaccines for things like rotavirus, waterborne illness, pneumococcal pneumonia, and related diseases, you can save tens of millions of lives. And now where we are with vaccines, both what the U.S. government's doing bilaterally and multilaterally, has achieved great success. And then just a few other ones here. You see polio, 99%, of those deaths have been eradicated. Obviously, the disease is not eradicated, so that's the wrong word to use, but 99% reduction. Now just a few sort of outposts where it remains, but near eradication. And then on malaria, tremendous success. So you see these stats, I think it's in the hardest hit countries that we've reduced malaria deaths by 75% in the last 15 years. This has been achieved because global health has been a bipartisan issue. It's been one that has enjoyed support from administration to administration. A lot of this began at the end of the Clinton administration. As you know, George W. Bush made this a really huge part of his legacy in foreign policy in terms of creating the PEPFAR HIV/AIDS initiative. These folks you see on the screen here on HIV/AIDS, so Bill Frist and John Kerry, before there was a presidential initiative, wrote legislation together, Democrat and Republican in 2001. Dick Durbin and Rick Santorum could not be more opposite in terms of a far-right conservative, a far-left liberal. They were the ones who secured funding every year for the Global Fund to fight AIDS, TB, and malaria. And I remember bringing Bono in to meet with the two of them. Their staff hated it because the politics said they shouldn't be working together. When Santorum lost his seat, in fact, the Senator Durbin's staff didn't want to meet that year because they didn't want to give him any victory whatsoever. But when Bono showed up, they came together, they met, they did their amendment, they got more funding, and it showed that on these issues of global health, you can achieve bipartisanship. And then just seeing the presidents together here, and this would be cutting across all sorts of administrations. There, President Bush and Clinton, they launched, you might remember, the Clinton-Bush Haiti Initiative. And you've seen all sorts of other partnerships among the presidents, which has been very inspiring. This is going to carry us now into the panel. So these are just some topics that we'll come back to in terms of looking at, I can't really see very well here, but sorry, I'm going to look over here. Basically, if you look at these issues, I don't need to read it, but sort of what's the environment that we're in now? And you've had a major changeover in terms of, or we're going to have a major changeover. Some of the champions we've had in global health have retired, figuring out who these new members are. What are going to be their perspectives? How does the new political makeup of a divided Congress impact global health? How will Democrats in the House work with Republicans in the Senate and the administration? Budget and appropriations is really at the center of all of this in terms of, are we going to provide the right level of resources? What are the challenges we face in terms of deficits, in terms of the administration's proposals? So we'll talk about that some. And then whether or not we can maintain this set of issues to be bipartisan. So I think with that, I'll leave this up here. Because these are some topics that we're going to get into. I'll invite up our panelists, and then we're going to get them introduced and start firing away some questions. So please come on up. All right. Good to see you. Hi, Jason. I'm Brandon.
I don't have a mic. Can I use
You
that?
don't, yeah, sorry, the battery went out.
No,
You're going to share mine?
I figured you're projecting.
yeah.
Yeah.
I feel like I'm right in the PowerPoint presentation.
Use this to, let's see here.
There we
There we
go.
go.
Yeah, that's better. This is wireless, actually. Why don't you give that to Jason?
Sure. No, we can share.
Okay.
Yeah, sure. Yeah, if you don't mind.
Yeah, of course.
All right.
Great. Well, welcome our panel up here, and we're going to have them provide a little information about their organizations and their work. So maybe we'll just start going down this way. And Jason, I'll hand it off to you. So Jason Carter, chairman of the Carter Center Board of Trustees, former state senator here from Georgia. Maybe Jason, if you want to provide a brief introduction about sort of your work and how that relates to global health.
Sure. So first of all, thank you for having me. And I'm very excited about this first public event. I'm very excited that these groups have gotten together in Atlanta in order to sort of bring this really remarkable set of players that are in this town to the forefront of some of both our economic development opportunities, but also other ways to get together. Obviously, the Carter Center has been doing public health work for many years. Some of our greatest partners are in this building. For example, we do a variety of implementation on the global health front for many of the people that you had up on the board there, the Gates Foundation, DFID, USAID. Most of the Carter Center's public health work is in what we would used to call neglected tropical diseases. Obviously, we still do that now, despite all the attention that has been paid. But the Carter Center here in Atlanta spends about $150 million a year on public health. Some of that is in-kind contributions, many of which flows through this task force in the form of donated pharmaceuticals that the Carter Center then distributes. But we, the primary places that we work, obviously we've led the Guinea worm eradication program throughout the world. In 1988, there were 3.5 million cases. That last year there were 11. And the final push there has become a very complicated one, but we're still there. We also deal with trachoma, mostly in Amhara, but also in Niger and a few other places. But Amhara is a 20 million person region of Ethiopia that's the most endemic in the world, that we believe will have eliminated trachoma as a public health problem in Ethiopia in probably 2 years. That's my estimate, so it'll probably be 3. But that is the work of the Carter Center. We've done work in river blindness in the Americas and then in Nigeria and a variety of other things like that. We also have done public health training both in Ethiopia and in Liberia, and we currently have programs in Nigeria and Sudan that do that as well. We have begun an advocacy program, and we're looking forward to the rest of the discussion. And I have some knowledge of politics, but I'm not sure that anybody knows what the world looks like today. So
I got it on my ear.
Just kidding.
So Brandon, I'll hand off to you. Brandon Ball is the Senior Lead for Congressional Relations at PATH based in Washington, D.C. And maybe Brandon, you can offer a little introduction to PATH and your work.
Yeah, so my name is Brandon. I am the Chief Lobbyist and Advocate for PATH. We are an entity that's based in Seattle. We've been around for about 40 years. Working in about 70 different countries, 1,700 employees around the world. People know us primarily as a product developer. We make vaccines, drugs, diagnostics, ways of keeping vaccines cold. If you've ever seen a vaccine vial, it's got a little dot on it that changes colors if it's too hot. It tells you when it arrives in a developing country if it's still good and able to be used. We co-developed that with a company in New Jersey. We also do a significant, or sort of a jack of all trades as well. We, if you're at WHO and you're talking about things like malaria, chances are someone from PATH is going to be there. We employ a lot of former U.S. government officials. And we also do advocacy. Spend majority of our time helping communities translate what they want to get accomplished into political rhetoric that makes sense for both sides. We've been able to achieve, within the last year, at least a couple $100 million for global health that didn't exist prior. So we are very effective at what we do, but my job specifically is to make sure that both sides of the aisle view PATH favorably and that we are at the table when policies or funding for global health are being discussed.
Thanks, Brandon. I'll pass it on to Danielle. So Danielle Heiberg is a Senior Advocacy Manager for the Global Health Council, also based in Washington, D.C. Danielle, maybe give a little intro.
Hi. Thank you again for inviting us to speak today, and thank you to Maria for organizing and to the task force for hosting us tonight. The Global Health Council is based in Washington, D.C. We've been around, we're coming up on our 50th year. We did have a few years ago sort of a streamlining of our organizations. We're down to 3 full-time employees, but I like to say we're still strong in what we do. We are a membership organization, so we don't actually implement projects in the field, and we primarily focus on bringing together other advocates as well as implementing NGOs to focus on the advocacy of global health in Washington, D.C. It seems like a very D.C. thing to talk about, but we do have what they call roundtables in D.C. They're roundtables that cover every disease that you could think of in global health, as well as some other areas that are not necessarily funded by the U.S. government, like frontline health workers. There's one on research and development, which is the Global Health Technologies Coalition, and they do all of the work behind the advocacy in Washington, D.C. I know Brandon and I go to almost all of those meetings every month to focus on our advocacy strategy, on U.S. policy, on our engagement with the UN and WHO. And so Global Health Council provides some of that coordinating and messaging around that advocacy so that when we go up to Capitol Hill, we're talking with one voice and not sort of dividing ourselves, especially in a time when the fiscal constraints around the budget can be tough. We're trying to make sure that we can get the best policies and sustain our investments in global health across the U.S. government.
Great, thanks, Danielle. And then lastly, we've got Jeremy Tolbert with us, who is the Southeast Outreach Director for the U.S. Global Leadership Coalition. So, Jeremy, maybe you can tell us a little bit about USGLC and your work.
Yeah, certainly. Thanks, Porter, and thank you, Maria, for having us today. Certainly appreciate that. I work for an organization, as Porter said, called the U.S. Global Leadership Coalition. We are an advocacy organization of 500 businesses, nonprofits, faith, humanitarian groups, and we support U.S. development and diplomacy programs, including global health programs. So we are laser focused on the international affairs budget, just about 1 to 1.2% entire federal budget. So I work in the Southeast with advisory committee members, members of Congress, congressional staff, candidates for Congress to engage them on these important issues. So I look forward to the discussion tonight.
Great. Thanks, Jeremy. So I think now we're just going to throw some questions out to the panelists. And please get thinking of questions you might want to add, or if you've got some thoughts along the way, feel free to raise your hand. We can call on the audience as well. I made a little bit of reference earlier to budget cuts that we've seen the last couple of years. Jeremy, I might come back to you first, just because I think it's helpful to start sort of at the macro level and then come down. You made mention of the fact that U.S. foreign assistance, if you look at it in its totality, so there's the international affairs account, which is about $55 billion. So that would be, as you mentioned, sort of between 1% to 2% of that official development assistance, which is sort of the global health and other forms of humanitarian development, as we talk about, is about $35 billion, as I mentioned. I'd be curious to sort of get a little bit more, from the standpoint of what USGLC is doing. Like you mentioned, you're a regional director, you're working in 5 states. Both sort of what, I guess maybe a couple questions to you. One is that leading up to the election, how are you guys engaging, trying to sort of shape the environment of now some new members of Congress who are coming in? And then just any sort of insights you would have from your guys' work across the country about what we're looking at in terms of this new crop of lawmakers in Washington.
Yeah, certainly. Yeah, so over the course of the last 18 months, the USGLC, we went on an effort across the country to meet with congressional candidates. We found that it's much easier to engage with them, meet with them before they hit Congress and are swarmed with a lot of information. So we have met with 80% of the new incoming House members and all of the incoming U.S. senators. One thing that we have found throughout the course of the last 18 months is this new group of lawmakers. They have a more internationalist, globalist perspective than an isolationist perspective. So for USGLC, we were not really focused on, is this a red wave or is this a blue wave? Republicans, Democrats, who gained more victories in this midterm cycle. It was, is it an internationalist, globalist wave or an isolationist wave? So we were very pleased, I guess you could say, at many of the new incoming House members as well as senators. So that was one of our big focuses on the last 18 months. And as we sort of transition into the new 116th Congress, we're going to work to maintain and build those relationships even more.
Thanks, Jeremy. And maybe kind of sticking with that, we'll just open it up to the other panelists. We can come down, Danielle, if you've got some thoughts, and come back to Jason here. But I'd just be curious to, we're just out of the election. So for those of us who are in Washington who've been tracking this, it's really too early to make determinations on a lot of this. We haven't seen new leaders elected, which starts tomorrow. We haven't seen new committee assignments. But I'd be curious, Danielle, Brandon, Jason, like your guys' thoughts in terms of any observations, again, thinking about just immediately looking at this election, having a Democrat-led House. Some of the new members we're looking at, some of the leaders we've lost. What do you think initially that might mean for global health?
Well, I think this is something that our community has been thinking about months before the election. We recognize that a lot of our congressional champions were retiring, and that meant that for the coming year, we were in a bit of a bind. There's things called Dear Colleagues that are sent around up on Capitol Hill that are led by members of Congress in support of of appropriations for many global health programs. And we were losing some of our congressional champions that would actually be the ones to spearhead these letters and circulate them to their colleagues. So this has been something that we've been thinking about for quite a while, and what all these retirements meant. I will share a little personal anecdote. I know on election night, as some of the more moderate Republicans actually started to lose, I was a bit disappointed. I am a Democrat, in case you couldn't tell. And my husband was very confused. He couldn't understand why I was disappointed that Republicans were actually losing and we were flipping some of these seats. And I kept trying to tell him it's important that we're able to work across the aisle. And we were losing some of our Republican champions as well. And that, I think, is also critical to our community. We need both the Democrats and the Republicans behind these accounts. The other thing that I think we are excited about is the possibility of having all these new congressional members coming in that maybe aren't familiar with our issues, but are open to learning about global health, about international development, about how global health and food security and WASH all work together, and why it's critical that we be funding across the entire international development accounts. And also the rise of some of the more junior members, members of Congress that have maybe only been in for 1 or 2 terms and have not yet found those issues that they really want to get behind. This is really a great opportunity for our community to come together and try and find these new champions that can be the voice for us moving forward.
Thanks. So I'll just tackle the 3 C's: the chambers, the committees, and the caucuses. I think in the chambers, and not a whole lot is going to shift in the Senate. I think we lost a number of our champions. There are still members who are committed to this, like Lindsey Graham from South Carolina. And I think where we're going to feel it most is going to be the Senate Foreign Relations Committee. There's a new chairman going to take Corker's spot. Jim Risch, who is primarily focuses on national security issues, Iran, North Korea, and isn't as prone to focus on something like global health. It's going to be a real priority setting for us, because we're going to need to get in front of them and convince them why global health is important for the community to take notice of. I think on the House side, it actually helps us a little bit more. A lot of the members in the committees are shifting. Some of them have retired. Some of them lost their seats. So there's going to be a lot of new members who are going to be stepping in that we need to educate. And I'd be remiss to mention Jeff Flake. Jeff Flake is a senator who chaired the African Global Health Subcommittee. They didn't hold, I don't think, any hearings while he was chair, and we hope that the incoming chair is actually going to reprioritize or at least hold hearings in global health that will help bring visibility to the issue. In terms of the caucuses, we have something called the Congressional Global Health Caucus. They are the conduit through which a lot of the NGOs who work in global health engage. Dave Reichert, who is from Washington, where PATH is based, was the outgoing conservative chair of that caucus. We were grooming Dan Donovan from New York for at least a year to take that caucus co-chairship over, but then he lost his seat, surprisingly. So there's going to be a lot of efforts that we have to put in to getting someone to step up in that position as well. But I do think that the landscape itself is extremely, there's so much promise and opportunity for members to step in. We think of Donna Shalala, who was on the National Biodefense Blue Ribbon Panel and now is a member of Congress, who can look at things like pandemic preparedness. There are a lot of members who are really teed up for championness that we're going to be cultivating over the next couple of years.
And I have more of a local perspective, but I will say this. I think I was just recently on the Hill, and with like I said before, I have some knowledge of this stuff, but the most interesting thing about what the world is going to look like when this new Congress gets sworn in is, you've already seen Congress, at least on this issue, stand up to the president repeatedly. And I think there has been almost bewilderment. I would love to know whether y'all, I don't know y'all if you're allowed to describe it like this or not, but there has been, by my understanding, on both sides of the aisle, just sort of bewilderment with how to handle what the White House is doing day to day. And so it is not just the Democrats, screaming in outrage, and it's not just the Republicans falling in line. There's a lot of volatility in terms of what the White House is doing in general. And so that aspect of sort of the general atmosphere impacts global health in very real ways. But I think this tradition that we have now established over the last several years, due in no small part to the kind of advocacy that these folks do in Washington, demonstrates that there was at least a bipartisan real coalition and consensus surrounding some of these issues. You know, the fact that George W. Bush led such an enormous and important charge with respect to public health in Africa and other things. No matter what you think about the rest of George W. Bush's presidency, it's a remarkable legacy that I think is what is being sort of felt in Congress's ability to push back on the president's attempts to cut these issues. I'll say one other thing. We have, I think, the benefit of a good and understanding senator from Georgia on the Foreign Relations Committee in Johnny Isakson. And when he comes down, he sends his top foreign policy people to come to the Carter Center in Atlanta to get briefed. Obviously, the Centers for Disease Control and this public health alliance that is here in Georgia, and particularly in Atlanta, is important and is an important advocate. There is nothing, I think, that is more effective, and this is one of the things you mentioned at the beginning, as far as, you know, communicating with members. Nothing is more effective than having actual constituents that are important constituents come to those members and talk about it. And so the fact that the University of Georgia, the fact that Emory University, the fact that Georgia Tech, Georgia Southern, and then the CDC and this type of global health alliance, these kind of advocacy programs are incredibly effective at talking to folks that are going to be important to be congressional leaders and Senate leaders on these issues. And so I think in that context, you know, we've got an interesting playing field, and one that I think is essentially unprecedented with respect to where this leadership is going to come from. And that just heightens the value of the kind of local efforts like this to make sure that our Congress people and our senators understand that how important this issue is, both to our economy at home and obviously globally. So that's my 2 cents. I'll say the other people, this next generation of leadership, people like Chris Coons, who work across the aisle on a lot of these issues, that have taken multiple trips to Africa just to sort of have people get off the plane, is really effective and valuable. So, but these are the experts on these issues.
Thanks, Jason. You teed up sort of 2 more questions I want to ask. Maybe I'll ask them kind of together to all of you. Is we've made some references, I did earlier, to the budget cuts that we've seen from the Trump administration, Congress stepping in, rejecting those cuts. So I'm curious, one, to get the view across your organizations, your advocacy of the administration, you know, any lessons you've learned or any observations you would share with regard to, we've got, you know, 2 more years here, the second half of this term of the Trump administration. Anything you've learned that you think could create some opportunities in global health? And then the second would be sort of turning it back to Georgia, what Jason was getting to. I spent some time with Maria and the Georgia Global Health Alliance this morning talking about the advocacy work that they can get involved in. And you do have a tremendous base here of work going on in global health across government and corporate and foundations and NGOs and universities and the faith institutions through mission work. I'd just be curious to get your guys' take about, for the audience, you know, what are some ways that they can get involved in this? So maybe we'll start with Jeremy again.
Yeah, I think Jason made a really good point earlier about taking constituents and meeting with their members of Congress. That is the whole USGLC model in the field. It's what we do. We take in advisory committee members. Maria has been on several in several meetings with us, with local members of Congress. That's our whole model, is taking leaders from the NGO community, the faith community, the business community, and go in and essentially we all make the case together. We found that that's very effective, and that's something that we'll continue to do. As far as opportunities within the Trump administration, our coalition, we are primarily focused on Congress because they, of course, control the purse strings, but we do have some administration outreach. There might be some opportunities with veterans. I know there are a number of new veterans who are now or will be House members when they're sworn in January 3rd. So I think there's an opportunity there because of the president's support of the veteran community. And also possibly, I know Ivanka Trump has interest in child and maternal health and somewhat global health. So there might be an opportunity there. We have engaged with Ivanka and her staff on several occasions in recent months. Possible opportunities there. We'll have to see.
in addition to bringing in constituents to meet with members of Congress, I think it's also important for implementing NGOs to bring in field staff as well. I think when members or staff have that opportunity to hear firsthand what is going on in the field, it really has a greater impact. People like Porter, Brandon, and I were up there on the Hill all the time. They hear from us all the time, but when they hear those firsthand accounts, it has a much stronger reach to many of these staffers. Many of these staffers actually have never been to rural Africa or even seen a clinic in rural Africa. I've heard stories of some of these staffers going on congressional delegation trips and being surprised that there's not a blood pressure cuff in a clinic. And so if we can bring those firsthand accounts to them, like I said, it has such a greater impact. In terms of the Trump administration itself, I would say despite a lot of the rhetoric we hear around them wanting to disengage with the UN or other sort of global fora, they do continue to engage. There was just recently, a few weeks ago, a primary healthcare meeting convened by WHO in Kazakhstan. And primary healthcare tied in with universal health coverage seems like an issue that the administration and frankly, a lot of members of Congress don't want to touch because of our own domestic healthcare system. But surprisingly, the US did send a delegation and they had a strong presence there and they were engaged. UHC might not be a terminology that we go up to the Hill and use, but they are not opposed to hearing things like quality services and equal access. So it's just finding sort of the right way of getting in and making that connection with many of the staffers in the administration.
I think it's important to differentiate the president himself and his administration. I think that there are a lot of really good people. Mark Green, for instance, who was leading the USAID. I think there are a lot of committed political staff that are placed in offices around the world. I think there are a lot of career staff that have dedicated their lives to global public health, like Zara and Thomas over there with CDC. Who are awesome. But I think that they're just, when you hear about the Trump administration doing things, I think that you have to kind of put it in one of the two buckets. Is it the president saying something or is it his administration doing something? And I think within that, you see a number of people who are sort of opposed to the U.S. role in the world, like John Bolton, the National Security Council, who have their own issues. They're not really opposed to the U.S. being involved in the world, but they have their own agendas. And then you have folks that are just dedicated to these issues. So try to figure out is the president saying something about cutting funding, and how does the agency respond? For instance, when the president says don't spend any more money on foreign aid, you don't see the Office of Management and Budget completely cutting foreign aid. You see them kind of walking it back, with everyone in DC sort of understanding that Congress will play a role in putting that money back. I think that that's something you don't really see on TV very often. I do also think that the president is oftentimes surprises people. When he met with Bill Gates, he said, tell me about HPV, right? Which isn't something that the U.S. is really focused on. It is a health issue, but he saw a billboard somewhere on his way to Mar-a-Lago and brought that up. And Bill Gates was very confused. He said, "Do you mean HIV?" And Trump said, "No, I mean HPV." So now you have, a champion for women's health in the president that then trickles down. So there are a lot of things that I wouldn't discount just because of something he says on Monday that changes on Tuesday.
And that volatility is what I was talking about. And to me, the leadership on this issue. I'm glad you mentioned Mark Green. I mean, there are people there who are doing great work and who can be lobbied, but I just think to really, and that again, I come back to the slide that you put up at the beginning. Congress is the firewall here, and Congress is a group of individual people that need to hear from their constituents, and that's really sort of where we are. And I think that it's an excellent point that, you know, and I think everyone is trying to deal with this sort of fact that the president is doing what the president is doing, and it has a relationship to policy only in a very tangential way, or at least sort of through a glass darkly, and you don't really know what it means. But the interesting thing about that is that ideally that is then left, you know, because this is such a tiny slice of the budget, you know, it's ideally left to folks who know what they're talking about, at least in theory, like Mark Green and others, to direct the actual policy. And so if you can ignore the noise, then you're sort of back to the fact that Congress is there, hopefully with the same coalition that has been there for the last several years. The last thing I'll say is all of us benefit enormously from firsthand experience, but political leaders, and this was even true for me in the state Senate, and certainly when I was running for governor, they are the most isolated people in the world sometimes, because in order to go get elected to the U.S. Senate, what you have to do is, you know, oftentimes is raise $20 million. In order to raise $20 million, you spend all of your time talking to people who already agree with you, who are really super rich and therefore probably isolated themselves. And then once you do that, you surround yourself with people who try to make sure you don't hear every phone call that you get. And you just progressively, you know, you end up then only talking to people in Washington who know who the chair of the Africa subcommittee is and whatever, and you stop sort of connecting. And that isolation, breaking that down is crucial. And when they know that somebody lives in Atlanta, cares about this issue, that's one thing. But if they get the opportunity to go and to see, it's a really powerful thing. And just to give a plug for an organization that I used to be a part of, and that Johnny Isaacson and frankly Georgia has a great long congressional connection to, is the Peace Corps. And that the stuff that goes on in the Peace Corps and return Peace Corps volunteers and people who've done this, it's had a long bipartisan history. I don't know how many people in here were in the Peace Corps, but there's experience for folks to go see. There's people who have the kind of experiences that you talked about, and that kind of just human connection, to me, is always the most effective way to change anybody's mind, but particularly that's true for members of Congress who end up being isolated just by the realities of American politics.
Just want to follow up on Jason's point. Your comments made me think of Ted Yoho, who came into the House of Representatives, who adamantly wanted to slash foreign aid. And it was his constituents and people who met with him, NGOs. And a year later, he is singing the praises of foreign aid in a way that no one could have expected. So even if your members of Congress are don't consider it a priority or, you know, opposed to it ideologically, there are always ways to connect with them and shift their thinking.
And again, that only happens with human connection, in my opinion. I mean, like, you know, there's a set of policies, and the good thing about foreign aid and about global health in particular is no matter who the constituent is, meaning no matter who the target of the persuasion is, that person has an incentive to do this, right? Because it's either they're the internationalist group or the isolationist group. Either way, they're on some level want to make sure that the rest of the world is not either being radicalized or whatever. I mean, there's ways to bring it home no matter what. And so we've got, quote, arguments that can do that. And you've got conservative reasons to do it. You've got liberal reasons to do it. It's sort of, that's why it's enjoyed such a broad consensus in the past. But making those arguments is what's sort of crucially important.
So I just got one last question, then we'll open up to the audience. And then just to follow up maybe in the few of the points that I heard here, my own experience in our advocacy work with the Trump administration, I would echo you and Brandon and Jason in that you've got to distinguish between the president or distinguish between the president and their budget office and the budgets that they've put forward, and then the leaders of these agencies. So Administrator Green, I've known for 20 years since he was in the House, and our ambassador to Tanzania is great. Former head of HIV at the CDC, Ambassador Deb Burks, who runs PEPFAR, who's our global AIDS coordinator, obviously Dr. Redfield here, other leaders that we have. The reality, though, is that they're constrained by the resources that they're given. And I do think that, you know, as Congress has provided level resources, I think that's going to become increasingly challenging when you see, you know, reports of $1 trillion deficit again next year, when we're spending 10 times more servicing our debt than we are on international affairs budget. We're spending $485 billion a year just paying interest on the debt. We'll spend more on the interest on the debt than we will on the Department of Defense within 3 years if we don't get a handle. That is going to
$800 billion, right?
730 billion by FY 2023. 485 billion, as again we're spending today. That's going to create more pressure on the Congress, and so I think
Purdue's going to fix that, by the way.
we'll take it. He does serve on the budget committee, and that's important. And so I just would note, though, again, going back to the Georgia-led advocacy, your lawmakers like Johnny Isakson on both sides of the aisle, they're going to need to be hearing very clearly and strongly from their constituents that we need to maintain this funding, because there's going to be a lot of pressure to be cutting as we're trying to deal with the budget deficit. So one area where the Trump administration has shown in global health, an area where they've been showing leadership, is around global health security. And I feel like you can't have a conversation in Atlanta with CDC around global health without at least having some discussion of what's going on in global health security. There are so many streams of activity right now. We had some of our government leaders in Indonesia last week at the Global Health Security Agenda Ministerial. There are strategies that are being developed within the administration. So I wanted to ask Danielle and Brandon, because the two of them really work very hard on these issues in Washington. Maybe you could just give us a little bit of a snapshot on global health security in terms of what are some of the key things that are going on now in Washington, and how do you see this agenda in the new Congress going forward and with the Trump administration as well?
Yeah. I think it's a really good case study in how you phrase something for an audience. When you think of pandemic preparedness or preparing countries to respond to Ebola themselves in a matter of 8 hours versus 8 weeks, we found that a lot of people think of or thought of global health security as a traditional bilateral aid program. They thought about it like PEPFAR or like malaria, certainly in the same budget category as those programs. And we were trying to figure out how to get this thing to stick, because those activities are so important, right? Like, there's a reason that Ebola showed up in Dallas. It was because countries in West Africa weren't prepared to stop it there. And the budgets for those programs had been kind of propped up with a lot of the money that Congress gave for Ebola, but that would eventually run out or would expire, and then programs themselves would be left to fend for their own devices in a budget environment that's not pretty. So we looked at how our communities were talking about it. We looked at how the defense or national security folks were talking about it, how the domestic folks, preparedness folks were talking about it, and we sort of rephrased it as a national security issue. We wrote a report. We started talking to the media. The media started writing stories about how agencies like CDC were have these programs that are eventually going to run out of money. And we just saw it sort of take off because we changed the verbiage of it. As a result, the U.S. has invested close to $300 million in the last year on programs within USAID, within state, within CDC. We saw that the Trump administration is now vocally committed again to global health security through 2024. They just made that commitment. Heads of U.S. government agencies are showing up to these global fora and making commitments. It's been really tremendous to see how something has been sort of taken up. It's a good success story to remember that the Trump administration, the agency heads do really good things, and they do pay attention when you make noise, just like members of Congress do. So right now we're in a position where agencies have what we consider bridge funding that helps supplement some of the funds that are expiring or that will go away. They're they're still poor, but they're less poor. And these activities in countries are going to start to scale back, but they're still going to do them in really important countries. I think they have 17 that they've outlined and more that they'll be working in. CDC works in almost 50 countries on these programs. And so when we're looking ahead, we're really trying to figure out if agencies who now have the money, where they're going to continue to work, what they're going to continue to do. The Trump administration that's now verbally committed, are they actually going to put resources in their own budget towards this? So there's a lot of questions about the sustainability of this work, but it's been a really great case study in how advocates can actually be so effective in not generating not only $10 million, but hundreds of millions of dollars and agency and U.S. government leadership.
I think what I would add to that is that this is also opened up an avenue of conversations around health systems in general. As you noticed from Porter's chart earlier, we tend to fund global health programs very much in silos. And we haven't looked at the entire health system. But now, after the 2014 Ebola outbreak, there definitely was some interest on what does it mean to do health system strengthening. And I think that that's a positive. I don't think, and I think everyone here would agree with me, we're not going to change this overnight. You're not all of a sudden going to see the US government committing investments to health systems itself. But I think it does give us the ability to think more about how we are funding the current programs that we're doing and how it is more cross-sectoral and how we can build a stronger health system that can respond not only to something like Ebola, but also other emerging diseases such as non-communicable diseases. I think we all are well aware of the rising rates of NCDs in the developing world and the fact that many clinics and health systems are unable to address these. So I think this gives us an opportunity to just think about the global health investments that the US government is going to be making in the long term and how we can be addressing these emerging threats.
Thank you. So let's turn to the audience now, and please feel free just to raise your hand and we can start taking questions for the panel. And Maria, do we need to use the microphone for the audience as well? Or yeah, please go right ahead. In the back. Oh.
Right now, there are so many competing global health priorities. And also, we are talking about like cutting financing and budgets and aids. So how do you US put forward these two situations together? And then when it's turned to the national level, the global health priorities doesn't fit very well to the national level priorities. So how do you merge those global health priorities at the national priorities?
Thank you. So just to repeat the question briefly, so one, how do we, when we are in a constrained budget environment or even looking at potential cuts, how do we ensure that we can push forward in all of these global health priorities we talked about? And then secondly, to the panel, how do we ensure that the priorities of the US government is putting forward is aligned with in-country national priorities? So anyone want to volunteer to jump on that?
I'll take the first question. I think that's in part why your voice matters so much. Because when you look at the priorities that Congress funds, it's in part driven by the amount of noise that communities make for specific issues. And so when you join a nutrition coalition or a vaccine coalition and you advocate to your members of Congress who are appropriators, or even those who aren't, who file member requests, basically they say, this is my priority to the Appropriations Committee, you're in essence creating noise that then helps generate funding for those programs. And I think when you look at national priorities, I'm not sure how you would actually get a Trump administration to, or the president himself to say global health is a priority. But we have seen successes with HPV. We heard that global health security might show up in the State of the Union address. He certainly pays attention to TV. So if the Ebola outbreak is on TV, he's going to be like, what are we doing about that? But I do think that just because it's not a national priority doesn't mean that the programs don't keep going. We keep operating regardless of whether we talk about, that we're operating, and we keep doing good work. Congress keeps funding it. And they keep funding it because it's successful. It's one of the best case studies that you can give Congress, because to Porter's point up, before, there's lots of data to show how impactful these programs are, what they do beyond just handing out a bed net, right? CDC actually has a great one pager that sort of breaks down the economic benefits for Georgia for investing in, she's holding it up right now. Those are the types of things that you go to Congress with, to make that case. And I do think that you also need a strong justification for that. So like if you see that nutrition budgets are getting cut and Congress is suggesting that, you should rethink, well, we should all rethink about how we're advocating or what verbiage we're using or what materials we have to make that case, because it does depend on the strength of the argument as well.
Can I jump in? And I sort of want to hear from Jeremy a little bit, if you don't mind me putting you on the spot, just because you spend so much time talking to candidates, right? But it seems to me, and this is a question maybe for everybody, who are the people that are out there advocating to alter the the thing that has been true for 20 years, which is that people think that we spend a lot more of our budget on this than we actually do. And frankly, what people think we should spend on it is a lot more than we actually spend, right? I mean, like, where is the campaign out there that says, hey, we are this powerful country who's doing nothing in these contexts, right? And one reason not to do that is as soon as you poke your head up, you raise the risks of it getting cut off, right? Like, I get that. And so I'd just love to know whether or not that sort of broad-based, sort of straight to the, over the pastors and straight to the folks in the pews sort of type of campaign, it would be effective, and why hasn't it happened in the past? Just wondering, and I don't mean to put you on the spot, but what do you think about that?
And also back to your point, it's a huge issue in this last election cycle that voters are just not focused on international affairs, foreign policy. Some of the exit polling had, I think it was less than 5% of voters were cared about international affairs issues. So these are not the issues that the average everyday voter is thinking about, talking about. It's not something they talk about with their families at the dinner table. So it's a huge issue in that just the average everyday voter in America it's not on the radar. One thing USGLC does, when we ask our advocates to get involved, and I'd love to meet some of you later and engage with you after the program, is we ask sort of everyone to contact Congress at the exact same time as far as the international affairs budget as a whole. I know we're talking a little more specifically about global health, but we only ask at those critical times during the budget process throughout the year, just so everyone sort of across the country is making that same push at that exact time. So I don't know if that answers your question, but.
Great. Maybe take next right here.
I'm wondering if you have any data on when Americans did feel like global health issues, global security issues were important, like during the 1918 influenza epidemic, during the Ebola. I would imagine there was more interest in this when they felt like they could be affected by a global pandemic. And I'm wondering if there's, no one wants to feed into the fear of the global pandemic on the one hand, but on the other hand, without people, members of Congress, and just citizens understanding what that might look like in this country, it's going to be hard to galvanize support for, I think, global health, because they need to realize that by preventing disease in a country is going to ultimately present disease in this country, potentially.
Maybe we'll take two questions too, so we can take them on. Another one, please. Yeah.
I'd like to throw this out. Mental health. We haven't talked about that at all. It is a global issue. I know the Carter Center has done, and Rosalind Carter herself, tremendous amount to highlight that issue. And even as it is affected by things like Ebola. After Ebola happens, you have mental health issues that bubble up to the surface and need to be cared for. And it's very hard to get attention for the global mental health issues. So what do we do to bring that to the table?
Great. So our two questions. The second one is, how do we mobilize more attention, advocacy, prioritization around mental health issues? And then the first question was sort of looking at, have we seen any evidence that around the health security or pandemic preparedness or response, we've been able to mobilize more support? I just offer one quick comment on the first question, which is that, and maybe Brandon or Danielle or others would know on the polling side, I haven't seen polling with regard to those issues resonate better. My assumption is, of course, they do. I will say that, just from experience on the Hill doing advocacy, when you're talking about Zika or Ebola or pandemic preparedness and response, it does just broaden the aperture tremendously in terms of offices that are going to be interested. I think when you go through something like Zika or having Ebola in Dallas, as you referenced earlier, Brandon, all of a sudden every office has to be able to respond to that as a policy issue. If you're not on the committees of jurisdiction on foreign affairs or foreign relations, or if you're not on the appropriations subcommittee that funds USAID or CDC, it's pretty unlikely you're going to have to go on the record talking about whether or not we should provide more funding for neglected tropical diseases or malaria. But I do think those health security issues, there's a sense that the broader Congress has to deal with that. But it'd be great on both those questions to open it to the panel.
Yeah, and I can take the mental health question if you guys want to talk about the other first. Sure. I mean, we one of the things we want to do is talk about mental health, and we appreciate your comments about sort of my grandmother's 50 years now of advocacy on mental health, and the Mental Health Parity Act now 10 years old, and we still have a hard time having those discussions in the United States. And what the Carter Center has done in two contexts that I'll mention internationally. Number one is journalism training, and that the journalist training in the United States has been one of the most effective programs that we've had about dealing with stigma in the United States. And we have expanded that to a variety of places, including Colombia and South America, including even the Emirates, in a very strange media environment and with an environment with an enormous amount of stigma surrounding mental illness. And we are expanding that to Eastern Europe and other places as well. But with respect to Liberia in particular, that is a country that several years ago had literally one trained mental health professional in the entire country to serve 6 to 8 million people, almost all of whom had been internally displaced at a minimum during the long war, many of whom then suffered a set of post-traumatic stress disorder associated with Ebola and other things, right? So you're talking about a country that had an enormous set of shocks. And one, as I said, trained mental health professional. The Carter Center, one of the things that we do that is different than almost anyone else is we work almost exclusively through the ministries of health in countries in order to build capacity. So through the Liberian Ministry of Health, we put together a training program so that over the last several years, we trained 217 trained mental health clinicians that are now spread out all over the country. And that just is a capacity change that is so dramatic that you almost can't fathom how important it is. And that was, it was so also inexpensive that it is replicable so many other places. And so one of the things that's heartening about both of those two aspects is just last month in October in London, there was a global ministerial meeting around global mental health. And it was the first time that a number of ministries of health got together. The Prince William and Kate came. I mean, it was like a huge ordeal. And so, but it was about global mental health, and it was a coalition of donors. It was a variety of other people, and it was really the first time that anything like that had happened. And the amount of attention and energy, it seemed like an inflection point. So I think what you'll see is programs like, and I might as well just say it, like the Carter Center's journalism training, like the Carter Center's mental health clinician training, be able to be replicated and find a lot more donor interest than we've had in the past. And what we've done in the past is we've just funded it with unrestricted funds from the Carter Center. 90% of our work is bilateral and other types of, sort of direct grants, what we would call restricted funds. But we've always funded the mental health programs through this just Carter Center money, as we would call it. We're going to continue to do that. But the interest in global mental health really is increasing, and the type of work that's going on in places like Nigeria that have grown up sort of organically in a lot of these communities. And some of it is, I joke about William and Kate, but they're a big deal. Lady Gaga's a big deal. Like folks that are out there talking about mental health issues and putting it on the forefront, especially of young people. I think you're getting to the point where there's a generational change in the stigma associated with it. And as we move forward, I think you're going to see a lot more change with respect to mental health. And the only thing I'll point out about polling, and then I'll pass it on to the experts, is it is true that things have to come crashing home, I think, for people to wake up sometimes. But another way to do this is the economic case that's being made, for example, by the Metro Chamber of Commerce and others, is another way to let people know that these things matter at home.
Can I piggyback off the mental health issue?
No.
Okay, that's fine.
Please, let's talk about mental health. That's all we want to do.
So from a DC perspective, I'm just going to get candid with you for a minute. The first thing that would be extremely helpful is to get Gates on board, because the majority of NGOs that operate in DC are operating on Gates grants, and those Gates grants have priorities. And if mental health is one of those priorities, they have deliverables tied to that. And so if you open the door for Gates to do that, or if Gates chooses to do it, you have a lot of organizations that depend on Gates money that are now at your disposal. The second is, if you're not getting traction with mental health, global mental health, tied to another issue, tied to early childhood development or nutrition, which is, in a big platform right now, is there stunting that leads to brain, defects or something? And there's got to be some way to tie it to something that's already hot button. Third is you got to find a champion. You got to find somebody to say something. You can do that effectively by contributing to political campaigns if you have the ability to, because they will say things that their donors choose to prioritize. But you also can find people like Dan Donovan, who recently lost his seat, but was a huge champion of early childhood development simply because people just kept pestering him about it. So you want to find you want to find the argument that's going to swing David Perdue, in your direction to start saying things about it on the global stage, and then just sort of, keep ramping on that. But until you have a champion or until you have a funder in DC that's really putting money in NGOs' pockets that go toward advocating for that, it's going to be difficult on the global side. And to John, pandemic preparedness is really interesting. I find that we spent 6 months throwing ideas against the wall to figure out how to communicate about it. The reason I use the Dallas example is because it brings it home. I think I'm so glad that we eradicated polio, but I think, that generation of people who suffer with polio firsthand, had a better understanding of, how that might impact people globally. When we talk about malaria, most people have never had malaria. But one of the things that we're trying to figure out is the cyclical nature of outbreaks, right? When Ebola shows up in Dallas, it's different from when it shows up in the DRC. Right now, it could, it could be uncontainable. According to Dr. Redfield. And that's a scary, scary thing. But until it shows up on the shores, unfortunately, it's going to be harder to get Congress's attention. What we did find is that we threw a really wide net, and we found the people that really were interested in it, like Ted Yoho, because he's a veterinarian and he has an interest in animal health and how those things translate, swine flu, bird flu. And we just picked those people and we just kept feeding them information and intel until they started saying things publicly, right? And then they get their friends to talk about that, right? And so we, there's a variety of ways to tackle that issue. I don't know how you get Americans to do that, but I'm not sure if my mom knows what Ebola is.
I really great. I know you have a lot of questions, but you could do a really interesting national demonstration on the National Mall in Washington, D.C., invite schools of public health to come in and look at what does it look like if you have thousands of people who are sick and I think there could be a very interesting way to inform people. But I don't know how far you all, you're out in global health, I'm in non-communicable disease. I don't know how much you want to get into the fear factor because, whether you want to go down that.
Well, we do like the Johns Hopkins University does simulations where they bring members and staff in and they replicate what it's like when Ebola starts spreading.
The only thing I want to add is one, Kaiser Family Foundation does do polling on this quite frequently. I was actually looking just last night to find their most recent poll, and I think the last time they did it was in 2015 or 2016. But I think part of the difficulty is that we often break those polls. One, public often doesn't know what global health means. I don't know how many times I've had to explain to someone exactly what I do and how that all fits in. But two, I think a lot of times they focus on the diseases again. Do we want to help someone living with HIV/AIDS? Do we want to save mothers' lives? Do we want to save the baby that was just born? Which is really great that Americans are supportive of that, but they're not, again, I hate to keep harking back on the health systems. We're not looking at things like how are we building laboratories? How are we ensuring that there are pharmacies and a mother can get the medicines that she needs? And that's sort of the less sexy side of global health that a lot of Americans aren't thinking about and that we are funding. So that's all I'll say on that.
Great. So I think maybe we'll take this may be our last round of questions, but we've got three. Why don't we start here and we'll go this way.
Thank you for your time tonight. This has been really interesting. You've already answered most of my questions, but since most pandemic diseases are vaccine preventable, do you guys find that the anti-vax sentiment is a real issue when you speak with policymakers and committees, or is it more just minority that gets a lot of media attention?
You want to take that quick?
Yeah. Short answer is Congress is really smart, and when they hear things like Robert Downey Jr. or Robert F. Kennedy Jr. Say things that are anti-vax, it doesn't translate to Congress. Most people are bought and sold on the evidence and science.
1, 2. Well, let's take them all since we have a new moderator.
Yeah, no,
One, two.
Jason, you're doing a great job. Yeah, yeah, Harris.
I recognize that the thrust of tonight's meeting has been what's happening with respect to here and elsewhere with respect to global health. And it's really quite impressive, the variety of initiatives, the energy that you see articulated here. Georgia itself, the backyard, needs major attention health-wise. We're not close to addressing and effectively the kinds of things that will lift Georgia 41st among the states here with respect to health outcomes. When you compare Georgia with respect to international countries, Georgia doesn't do that well. I guess the question I'd like to ask is, do you see anything happening here in the state? Or how can we mobilize energy and momentum here in the state to really get behind concerted effort? We know how to do this. We know how to improve health. We just need the momentum behind it. How can we make that happen?
Do you want me to take that one? So through organizations like the Alliance, a lot of our work the last 2 years has been very much behind the scenes, but one of our strategic initiatives is to fully launch a global to local program, or global, or whatever you want to call it. We have been in conversations with some large consultancies and some departments of health to explore how we can tackle specifically the rural issues throughout the state of Georgia in partnership with some rural health systems here in Georgia. And I apologize for being a little vague here because we haven't gone public with some of this yet. But really, I think it's going to come down to coordinating and convening a number of different types of parties that don't traditionally talk to each other. So people like experts from the task force that may be knowledgeable in health systems, and possibly partners such as MAP International, who's a member, who can help with providing expertise as well as product deliverables to communities at risk, and really implementing those global health practices in our own backyard. But we can't do that without partnering with the local community, the local health departments, as well as those that are delivering care, the hospital systems. And we fully recognize that those systems are not necessarily accessible to everyone. So that's why we're bringing in partners that do mobile clinics and other things like that. So we are tackling that from an Alliance perspective. And I think there are a lot of opportunities the Alliance, as well as the partnerships we're making through the Chamber and the business community, to really raise a profile of thinking about how we tackle public health issues outside of here locally in Georgia, and really anywhere in underserved populations around the country, to think differently about how we approach them and deliver care. So it takes time. Unfortunately, this isn't a quick remedy. It's not something we also just want to put a Band-Aid on. It's public health. We want to approach it in a very comprehensive and holistic way. So we're trying to bring the parties together to really think of things holistically. And I'm very excited about some of the partnerships we're exploring with some of the largest rural healthcare systems actually in the country that happen to be here. So we're taking advantage of those relationships. Do you want to? Anybody else?
I do think that the fact that our healthcare system is so messed up here makes it harder for us to advocate for global health. And you've mentioned that a couple times, that there's certain things that are off limits. There's building health systems, et cetera. I mean, I certainly would believe that if I was in Congress and you were coming to me saying, let's fix some health systems, I would say, all right, like I've got one in mind that we might want to fix now, to your point. So maybe I'm wrong about that, but I think that there's no doubt that we need to do one in order to make us better advocates for the other.
Yes. Mm-hmm. Yeah.
My question is for Jeremy. You said you work with the business community, and what I want to know is, how does the business community, the corporate partners, influence this scenario? What are some opportunities, and what have you done to engage them with the White House? Because like, they have interest in global health.
Yeah, absolutely. And that's, we engage the business community more so sort of at the 30,000 foot level in terms of American engagement in the world. Talk about tariffs a bit. That's been a hot topic of conversation recently. Yeah, as far as global health, specifically, some of the other panels would probably be better to speak about that. I do want to give one example. Caterpillar, back in 2011, was the first year that they started exporting their products, tractors, et cetera, to developing countries more so than traditional economic trading partners like those in Europe and Japan. So from that 30,000 foot level, it's obviously good for American businesses when America is a leader in the world, when we are engaged in the world. So we do have a number of coalition members who are businesses, the U.S. Chamber of Commerce, National Association of Manufacturers, and many others, including some here in Georgia. So Business Connection is primarily at that 30,000 foot level in terms of strong American leadership in the world, and that it's good for American businesses when America is engaged in the world. If that answers your question.
So, yeah, my question, I think, relates to that last point. I understand the Chinese government is making significant investments in civil infrastructure in sub-Saharan Africa. And so, but I don't know if that extends to health system strengthening. So if it does, I'm wondering, how I should feel about that. On the one hand, maybe they're doing good work. On the other hand, maybe we're missing opportunities to, extend U.S. influence. So, any thoughts there?
I'm in Georgia, so I'm going to hand this to anybody else on this panel.
It's a touchy issue. I think it's a good opportunity for the U.S. to show that what it does in countries like Nigeria is, for the most part, for the better good, right? For the greater good. There's a moral reason to do it. There's an economic reason to do it. But nowhere are we giving aid to countries with high interest rates and an expectation that we're going to, get something from them if they don't pay. I think what the Chinese are doing is really, it's beneficial for the world. I think sometimes countries themselves end up with the short straw, as we've seen in places in sub-Saharan Africa. But I do think that it just means that we have to be competitive and we have to continue to invest in these countries. Because if we pull out of America, if American leadership pulls out, China's going to fill that gap. And what we've seen advocates do with the Trump administration is to echo that point as many times as we can, to let them fully understand what it means if the U.S. retreats.
Just on the ground, I think throughout sub-Saharan Africa at a minimum, you see probably the most striking change over the last several years is the increase in Chinese construction. The number of buildings that are being built in places that don't have that many buildings that are being built by the Chinese government, et cetera. It's a huge deal. And one of the things that the Carter Center does in here in Atlanta is we have a program that is analyzing sort of these trilateral relationships between the United States, China, and the recipient country to see how it is that we can make sure that everyone's sort of pulling in the same direction. That is unlike anything else that anybody else is doing in the world. I mean, for the most part, we're advocating the way that he has articulated the strategic way of advocating. But the fact that China is there as a major player is real. The consequences of that for the recipient countries have been mixed. For example, there's been a lot of, they mentioned loans, as I understand it, and you correct me, Danielle, if this is not right, but for example, in Madagascar, they've built, giant infrastructure investments in a port, for example, and then have financed it and then have repossessed it. And so you're talking about the Chinese government actually now owning a variety of things that were going to be public goods at different times. And so there's a lot of complexity there, and that arc is going to be very long. But for right now, you're talking about a giant amount of investment that's going on, and it's very visible.
The platform that we've built over the last couple of decades, the U.S. has built, and being a global leader is really important because we can't match the Chinese in investment. And so we really, it behooves us to keep our seat at the UN and continue to plug in. And I think countries do, they do understand that when the U.S. is there, we are a friend to help them, and we're doing it for a lot of reasons. But yeah.
No. American hegemony is important, right? I mean, it's American leadership. If it's not us, then who is it? And right now, it's less and less us, and that's a real problem. And that's why the work that these folks are doing in Washington is such a big deal.
Let's do one. No, you're fine. One last question, then we'll wrap it up.
Just a comment about the question that Jim had about U.S. versus Chinese. I was in Afghanistan for 4 years working with democracy and governance from USA side. We had so much regulations to work with, working with the USA side in terms of waste management. We had to be almost compliant with the U.S. standards. Chinese had no regulations, so you're free to do so much things without any regulations. That we were restricted not to work with the Iranians to bring their products in Afghanistan because they're neighbors, but the Chinese didn't have that restriction, so they were more easy to work with in countries like that than our work in Afghanistan from a USA perspective. Just a few things.
And just to conclude, I mean, to his point, we're not going to compete in that way. It's, China's willing to do things we're not willing to do. A lot of other countries are willing to do things we're not willing to do. And so that moral leadership has to be the framework and the grounding of what it is that we do, if it's global public health, if it's anything else. And to the extent that that's eroding, that's a real problem. And I think that's why it's so important, again, that folks are here, that folks are spending their time. And frankly, it makes me happy to see that first thing, which is that Congress gets that, and frankly, the administration gets that, even if the president sometimes is willing to pretend like it's not as important as it is. And so I just think that the work you guys are doing is crucially important. You couldn't pay me to go to Washington. And so the fact that there's good people there, the fact that folks are still sort of holding down the store, I appreciate it. And those of us in Georgia, if there's anything we can do, we certainly want to help. And we're really glad that we have Maria and everybody else to have organized our ability to advocate on behalf of these things. And so call on us, and we're looking forward to getting back on the right track. So thanks.
No, you should just moderate all my panels, Jason, make things a lot easier on me. Thank you all for coming tonight. Thank you to our panelists. Let's give them a round of applause. I really appreciate you guys flying down from DC and driving from Midtown, Jason. I know that's just as terrifying on a rainy day in Atlanta. And very much thank you to Porter and Kyle House Group for their support the last 6 months as we've cultivated these relationships. The Alliance is working to be this voice and put on more events like this and bring more people down to help tell the story of what's happening in DC. I know we have a lot of noise happening up here from tweet storms from the president, but the actual boots on the ground, building the relationships and the connections with our policymakers, it's a very different perspective, no matter your personal politics aside, as Danielle pointed out earlier. This is, I've been doing policy work on the biotech side for years now. This is not an overnight change. This is building relationships over time, teaching people about the issues, educating them on a breadth of challenges from health systems that came up today, as well as just diseases and how they work. Politicians have to know a lot about a lot of issues, and it takes a lot of time to really brief them. But you can build champions even with people who you may not necessarily think might be a champion just because of how you see them reported on CNN or Fox or whatever you might watch. So I think this is a first stage for the Alliance in the policy world. I'm pleased to say our board this morning approved us fully moving forward with a number of policy initiatives with support from Kyle House Group. So please expect some more programs like this. I encourage you to get on our newsletter. I believe 95% of y'all are members because your organization are members already of the Alliance. So please get involved. We want to raise the profile of the sector, and our big strategic initiative, Global Health ATL, in partnership with the Chamber, is not only working on some very practical economic development pieces, but really going to be working with global health communications leaders to try to tell the story differently than how we have been classically telling it in public health. We want to be able to tell the story to policymakers with data that they want to hear around their constituents' input, understand the economic impact of preventing health in the first place over there, as they might say, but how it helps here. And also use local programs using global health practices in our local communities to show them firsthand how the importance of this sector that we work in. So we're working hard to tell that story. And really, I think in the end, Rob, my counterpart from the chamber working on global health ATL, we really want to start making some noise next year as a community down here in Atlanta. A number of us on the Global Health ATL Executive Committee and the Alliance Board, we feel there's a responsibility because of the depth of public health expertise we have in Atlanta to make more noise. Just because the CDC is not located up there fully, it doesn't mean we don't have a breadth of expertise, not only at that agency, but at places like the Task Force for Global Health, the Carter Center, CARE, and especially in disaster response areas like MAP International, MedShare, and a number of other partners, and of course our brilliant universities. So we have a responsibility. I think we might be a little late to the game in terms of coordinating an alliance, but we're off to a great start now, and 2019 should be a great year. So please stay in touch. And with that, I thank you all one more time. Please grab some food on the way out because I don't want to take all that home. And I hope you all drive home safely and have a good night. And thank you again to the task force.